Today, we are very pleased to welcome Dirk Kruger, who is a professor in economics at UPenn. He doesn't need an introduction. He's a leading macroeconomist, very well known to us. And today he will be talking about macroeconomic and redistributive effects of this crisis. So over to you, Dirk.
Okay, thanks a lot for having me. So I hopefully have at this point shared my screen and you can see my slides. So what I want to do in the next minutes is to essentially do three things. I want to talk about the epidemic sort of from a broader perspective, and then talk about one concrete project that I have together with Andy Glover, Jonathan Heathcote, and Victor Rios-Roll. And at the end, I want to briefly mention a project of mine that builds on the paper by Eichenbaum, Rebello, and Trabant that you might have seen in the last week, and give my take on that as well. When I talk about the specific project on health versus wealth, I will try to do this on a sort of fairly bird's eye view. A lot of the details are in the paper. I included a lot of the details in the slides, but there's quite a few slides I won't be talking about because of time constraints. So when I think about the recent COVID-19 crisis, I would identify three main areas or dimensions of the crisis. First, there's the health crisis, and I will show you some data on daily deaths and cumulative deaths. Then the wealth part of the title has to do with the real economy, what happens to GDP and unemployment. There, the numbers that we have are much more speculative, but I would like to give you those speculative numbers just to put into perspective of just how severe the crisis is and could be. And then there's an element that has to do with banking, finance, sovereign debt, and public finance, which is, I think, fascinating, super important, but I won't be talking about today. Okay, so if we start from the health dimension, so in this talk, I will use the words corona crisis and COVID-19 interchangeably, but it's important to keep in mind that COVID-19 is, it stands for coronavirus disease 2019. That is the disease caused by the virus, sometimes known as novel coronavirus. As of this morning, I looked at the numbers from Johns Hopkins University. There's about 2.75 million confirmed cases. My view is that the number of cases is much, much larger than that. And there's more than 191,000 confirmed deaths worldwide associated with the COVID-19 virus. Let me just give you a sort of a sense of how large this is, depending on the area that you're talking about. So the next three slides are taken from a fascinating paper by my colleague Jesus Fernandez Villaverde and Chad Jones. And what they are doing is they take a very standard model from the epidemiology literature called the SIR model, which I will talk about in greater detail later. This is a model that basically models people as being in one of three health states. S stands for susceptible. So these are people that are currently not infected, that have not had the virus, and therefore are in principle susceptible for receiving the virus. I stands for infected. So these are people that currently have the virus and can spread it to others. And R stands for recovered. So these are people that had the virus, have recovered from it, and are not currently infectious. And R could stand for either people that have recovered successfully and are immune to the disease, or it could be people that had the disease and had died from it. From the perspective of the SIR model, that makes no difference because both recovered as well as dead are absorbing states, and for the evolution of the epidemic doesn't make a difference whether you recovered from it or not. So what Jesus and Chad did, they take this model, make it flexibly parameterized and estimated for different regions of the world. Just to be very clear, in that paper, there's no economics in that paper. It's a purely statistical paper trying to estimate the best fit on the data. Their view, as well as my view in this talk, is that the hardest data that we have on the virus are death data. So rather than looking at active cases, they only look at data on deaths. And if you do this for New York City, you get what's on the slide currently. They use data up until April 12th, try to fit this SIR model through the observed daily death data. And what you see is that initially the virus has exponential increase in death numbers around here. According to their predictions, right now around we are at the peak of the daily death numbers, and then the death numbers will be coming down. How fast they will come down, that depends on different parameter values. But the idea is that currently in New York, we are around at peak death numbers, perhaps slightly to the left of the peak. If you do this, for example, for Italy, Italy is faster ahead in the epidemic. So there you can clearly see that the number of daily deaths in Italy has been trending down. And again, depending on assumptions on what you do about further social distancing, on how quickly you open up the economy, the predicted further deaths by this SIR model looks like that. Just to give you a perspective, what does that imply for the total number of deaths in Italy going forward? You get estimates that look like this. So this is the date. So right now we are around here, and this is the cumulative deaths per million of people. So this is 300, 400, 500. So depending on precise parameter values, the prediction is that Italy will end up in the number of deaths of about 400 to 500. I think this morning, according to Johns Hopkins, the number of deaths in Italy per million inhabitants was 424. And depending on the prediction, you're going to land somewhere between 450 and 500 per million people. So that's about 30,000 people dead from the corona crisis. So this is a massive health crisis. It has inflicted many, in fact, all countries around the globe. One way to further look at just how severe this is to plot on the x-axis the days since the first death, and on the y-axis the cumulative death per million. This is a log scale. So, going from here to here doubles the number of cumulative deaths. And what you see is that for many countries early on in the epidemic, you basically get a situation where every 2 or 3 days, the number of dead people doubles. And then, of course, all the effort is about flattening this curve, which, for example, South Korea, which had very rapid growth of early deaths, has then successfully done. This is the Hubei province in China. And these are some European countries with very rapid death per days, and recent flattening of the curve in Italy, in Spain, maybe less so in France, in the UK, and the like. So this is the health dimension of the crisis. It's a very large crisis. It has inflicted all major industrialized economies, and it has a massive death toll. Now let me turn to the economic dimension of the crisis, which with some delay is perhaps equally severe. And the remainder of the talk will really be about the tension between what do we do in order to fend off the health crisis, as opposed to the economic cost that such measures will entail. And my particular spin on this will be to argue that the benefits from curbing the health crisis, the benefit from mitigation efforts, the benefits from shutting down parts of the economy down will very largely accrue to older populations, whereas the main cost of the mitigation efforts will mainly be borne by younger people actively in the labor market. So that's why you need both the health dimension, which I've now talked about, and now let me turn to the economic dimension. The economic dimension requires very high frequency data, so this is going to be quite a bit more speculative. I focus here on the United States. I'm sure there's very good data for the European economies. I mainly will talk about the United States, and I think our data situation is probably worse than that in Europe. So let me show you one picture that I think has really made people freak out. So this is new unemployment claims over time. So you can see new unemployment claims in the Great Recession. If you look at the peak of the Great Recession, we had about 656,000 new unemployment claims in March 2009 at the peak of the Great Recession. So this is a 4-week moving average. And then here towards the end, so these are the most recent data. And here we go to a situation where new unemployment rate claims on average for the last 4 years, the last data is April 11th, are in the order of 5.5 million, or another number that you might want to keep in mind, about 24 million new unemployment claims in the last 4 weeks alone. So this is a massive collapse of the US labor market. Now, the next official number for the unemployment rate are not due until early May. But there's a very nice, very recent paper by Big and Blandon. What they have done, they have basically conducted an internet survey that tries to, in terms of survey design, trace the CPS. And according to their estimates, by mid-April, their estimates of the current unemployment rate in the United States currently, based on their survey, and that's certainly consistent with new unemployment claim, is that the unemployment rate in the US is already in the order of 20%. And there's a paper by Faria y Castro from the St. Louis Fed that uses this 20% number in the estimate of what might be the fiscal policy consequences of that. Now, these are not hard data yet. For official unemployment rates, we have to wait until early May. But if I were to have a guess of how severe the economic crisis already is in the labor market, I think a 20% number is quite plausible. Could well be higher. So this is substantially larger than what happened in the Great Recession, and we are in Great Depression of the early 1930s territory when it comes to the unemployment rate. So this is a very massive event. If you think about how large could be the GDP decline in the second quarter, where we essentially shut down large parts of the economy. Again, this is very speculative, but if I read reports by Goldman Sachs, more should be Morgan Stanley, I think drops in the order of between 20 and 35% are certainly in the realm of possibilities. So on one hand, you have a major health crisis with substantial number of deaths. I will show you later data that suggests that the deaths are very concentrated among the older population. On the other hand, you have a collapse in economic activity that is unprecedented in many countries for data after World War II, and is certainly on pace to look like the Great Depression of the early 19. What I want to do in the remainder of the talk, and this is now based on a recent paper that I have with Jonathan Heathcote, Andy Glover, and Victor Rios-Roll, and I should say that Andy Glover and Jonathan Heathcote, their employer are the Federal Reserve, is the Federal Reserve System, so nothing that I will say here reflects the official policies or opinions of the Federal Reserve. So what we basically do in this paper is we take the health crisis as given. We built a very simple model of the macroeconomy, and then ask, taking as given what the US did up until April 12th, what should we do from this point on in terms of what share of the economic activity should we lock down in what sectors, and how long should we maintain this partial lockdown, and when should we try to come back to normal in terms of economic activity? I think that's a very relevant question, because that's precisely the policy debate that's currently being led in the public discussion, at least in the US. And in terms of the model structure that is being used here, it's really in a very fundamental sense. It has a health block, an epidemiological block that's based on the standard SIR model. So I want to talk a little bit about the sausage making of this SIR model to give some context, and that model is merged with a very simple macroeconomic model where the extent of economic activity is basically determined by two things: how many people are healthy enough to work, and how many people are allowed to work as opposed to be shut down by government mitigation policy. I will then try to bring that model to the data and make sure that that model represents the actual situation on April 12th of the US economy reasonably well. And then I will ask a simple question. On April 12th, you can play policymaker and you can ask, how long should the economic shutdown still last, and what share of the economy should be shut down, and as I said, how long. One policy option is one that was flouted initially by the president. Say, we want to open on Easter, let's just remove all restrictions. That's one benchmark policy. The policy that's currently in place, to the best of our interpretation, shuts down 50% of the non-essential sector. So the sector that is non-essential for providing healthcare, food supply, and so forth. And that will last maybe until June 30th. And then we will ask the question, okay, from a perspective of social welfare, where I have to tell you what exactly social welfare is, how much should we open up? And how quickly should we do that? And as I said, the main theme of this entire talk is that there's going to be very substantial disagreement depending on whether you're an older citizen, mainly subject to massive health risk from the crisis, or whether you're a young worker working in a non-essential sector that's currently being shut down, where your employment and income or earning opportunities are basically disappearing, and where you yourself, you are subject, of course, to the health risk, but all the data suggests us that directly you're unlikely to become sick, and even if you do become sick, it's very unlikely that you might die from the virus because you're young. And then at some point towards the end, I will say, what's potentially missing in this simple model that you might want to model more directly. So of course, I'm open to questions at any time. But so as I said, the broad research question, what is the appropriate economic policy response? The specific question is, how extensive should macroeconomic shutdowns be? When should they start? When should they end? And the key point of the paper is that there's a very large distributional aspect from this policy debate, because the main beneficiary of the policies are protecting the old from getting the virus and potentially dying, being bought by young, still economically active individuals, and especially those that work in sectors that are deemed non-essential and therefore potentially subject to a shutdown. If you think about sectors like hospitality, restaurants, and the like, these would be the primary sectors that are affected by this shutdown. So what we, as I said, what we do in this project, we start with a basic epidemiological model integrated into a macro model where economic activity depends on the degree of a shutdown and the degree to which people are sick or not. One key aspect is that those people that are not allowed to work any longer, they have to receive transfers from the rest of societies, and we assume that those transfers are costly because you have to raise revenues, say with distortionary taxation, to transfer to those individuals that are banned from pursuing the economic activity. And then we analyze the combination of optimal shutdown and redistribution policy. And the catch, the interaction between these two policies goes like that. If you do more shutdown, you're going to have more unemployed people from the sectors that are not allowed to work anymore. In order to make that palatable for society, you need more redistribution. You have to provide these people with higher unemployment benefits. But if it's costly to raise the revenues to provide people with these transfers, then the appetite of doing mitigation becomes less severe, and that interaction might mean that you do less mitigation, less shutdown than otherwise, where redistributional concerns are not on the table. So relative to, say, a representative agent model, where the benefits and the costs are evenly distributed, because you have to transfer resources to the people that are laid off, and if these transfers come with excess burden of taxation, you might do less mitigation than you otherwise would do in a representative agent model, where redistribution is either off the table or is costless. And I will try to demonstrate that as we go along. Let me just make sure that I'm okay with time. So if there's no question, then what I want to do now is I want to briefly talk about the basic epidemiological, the SIR model that many of you might have seen, but I think it is important to understand sort of the basic sausage making of that model. I will focus on the intuition and not go through this precise math, but I think all of us that have sort of been thrown in terms of research into this topic I think the first thing that we have tried to learn is how this basic epidemiological model works and where it might potentially have to be extended in order to make it palatable for economic analysis. Because you might ask, look, we're all economists. Shouldn't we all believe in specialization of labor? Should we not let the epidemiologist work on that part? And we should sit at the sidelines and not worry about that. I will argue that economics has something to contribute, but for that, I think we have to understand where exactly, I think, the interaction between the epidemiologists and the economists have to lie. Okay. The basic SIR model. And as I said, the pictures that I showed you on the health side from Fernandez Villaverde and Chad Jones basically took that model and estimated a fairly flexible version of that model with actual data. So now I will provide you with a sort of underpinning model that basically these guys have estimated, and also the underlying model that many of us that have worked on this recently have used. For example, the Eichenbaum, Rebello, and Trabant paper is very much built upon that model. So let me try to explain how that model works. So this is a model that is cast in continuous time. Marty and Sergio and Matthias used a discrete time version of the model, but it works, of course, completely equivalently. So the idea is normalize the population size to 1, ignore the fact that there's population growth. This is a model about a very short run. An individual can be in one of three health states. You can either be susceptible, meaning you don't have the virus, but you can potentially get it. You can be infected, meaning you currently have the virus and you can transmit it to other people. Or you can be recovered, which might mean that you have had the virus and you have gone through it and now you're immune. The underlying assumption is that once you've had the virus, you're immune to it. Or you might have died from it, in which case you obviously also cannot transmit the virus any longer. And big S, big I, big R, these are the population shares in these states. At the beginning of the epidemic, nobody is recovered, nobody has worked through the virus. There's a very small fraction of the population that is currently infected. And that might come from China in the case of the United States, or this might come from transmissions from animal. Epsilon is meant to be very small, which means that the initial share of people that are in a susceptible state is basically equal to 1. And then this model is meant to describe the dynamic of the epidemic as it unfolds. And under the hood, there's 3 differential, or in the case of Eichenbaum et al. In discrete time 3 difference equation that describe how the number of susceptible, how the number of infected, and how the number of recovered people will evolve over time. The dot in front of on top of the variable means the time derivative. So this is the change over time in the number of susceptible, the change in the number of infected, the change in the number of recovered people. And so the key 2 equations and the key 2 parameters are given here. So the number of susceptible people, those that are not infected, is reduced over time, and the number of infected people is increasing over time according to the following logic. This is the number of susceptible people. This is the number of infected people. So if you want the product between the 2, is the number of meetings between somebody that is infected and somebody that is not infected, has not been infected, but is also not immune. And then at intensity beta, these meetings create new infections. So the number of susceptible people is shrinking at this amount. This is the number of meetings, S times I, and beta is basically the intensity at which infections transmit from the I people to the S people. So this term is negative, meaning the number of people that have not had the virus is shrinking over time. Where are these people going? Well, these are exactly the new infections that increase the number of infected people. So the number of infected people increase because there's new infections, and the key parameter that drives how many more infections we have is this parameter beta. On the other hand, there's now an outflow of people from the infectious state into the recovered state, where these are the number of people that are currently infected. A share kappa of them recovers, which either means they had the virus, they worked through the virus, and they are now immune to it. and healthy, or they might have died from the virus. So the second key parameter here is kappa. So that's the intensity with which you recover. 1 over kappa is the expected time length that you spend in the infectious state and are able to infect other people. So the two key parameters is the intensity with which you spread the virus to other people if you are infected, and kappa, where 1 over kappa is the expected time length that you spend in the infectious states. So these are, in the very basic model, the two key parameters that you have to get a handle on that will tell you how this epidemic unfolds. In fact, what is really key, and I will show that to you in terms of the basic math, is the ratio between beta and R, because remember that 1 over kappa, that's the expected time that you spend in infectious states, times beta. That's the intensity with which you transmit the infection. So R0, which has, it's a famous number, it has a name, basic reproduction number. That's the expected number of infection generated by one person that is infected. And to first approximation early in the epidemic, that's the number that you want to get a handle on. How large is that? The larger is this number, the more rapidly the virus spreads. And what I would say, and I would say that on the next slide, what really economics has to contribute is, if you're an epidemiologist, it's clear that you want to figure out how big is R0, and you want to perhaps think about, how is that R0 perhaps changing over time. I think the main insights of all the models that economists have recently constructed is that this R0, especially because of the parameter beta, this beta is not a policy invariant parameter, but that's exactly where economic mitigation, economic activity affects this beta, with the ideas that the more economic activity you have, the more infections per infected people you're going to have, the larger is beta. So clamping down on economic activity will reduce this beta. And maybe the biggest contribution that these recent economic models with an epi part have is to try to get a handle on how big is the derivative of beta with respect to economic activity. That's exactly where the interface between health and epidemiology on one hand and economics is on the other hand. Just to give you sort of a basic idea of how this works.
Dirk, before you move to this part, I have a clarifying question. So it seems that these models treat recovery and death as identical.
Yeah.
But death shrinks the size of the population, while recovery does not. So
absolutely. So on the next slide, I will actually break them up. And then in our economic model, that is precisely one of the factors. So we will actually argue that this SIR model, for our purpose, is not quite rich enough. I will break it up a little bit. And one of the things that you have to do in the richer model is to break up this R into a share of people that do recover and a share of people that actively die, because the recovered people, these are the perfect guys that you want to send back to the labor market if you know who they are, whereas the dead people, of course, you cannot do that. But from the basic mechanical evolution of the epidemic itself, it doesn't really matter whether the recovered people recover and are dead or are recovered and they're healthy, under the assumption, and that might be an assumption that might not be a great assumption, and there's a lot more research to be done, that the recovered people are in fact immune to the disease once they have recovered. Right. So what I'm saying is that from a basic epidemiological point of view, it doesn't matter. From an economic point of view, it hugely matters, and we will integrate that distinction into our economic model very much, because it makes a huge difference. Absolutely.
Yeah, I meant it more from a mathematical point of view, that in the differential equation, the third one.
Yeah.
Since everything is normalized, size population of 1, actually. Aren't these models sort of assuming that the death rates are sort of relatively small, so that you can approximate it with this equation?
Yes, that is certainly true. I mean, so early in the epidemic, death rates are 0, but even at the height of the epidemic, now we're talking about at most, perhaps, I mean, that's my hope, 30,000 deaths in Italy relative to a population of 60 million. So this is probably not a bad assumption, but both recovery as well as death from the perspective of the model are absorbing states, since there, I mean, if you see where R comes back, R never feeds back anywhere here. So the feedback is not there. Now, if you think that, how many people die, that might affect the birth rate and therefore population growth, then of course this is not the accurate model. But as long as recovery, both healthy recovery as well as death, are absorbing states for these differential equations, it really doesn't matter whether you're dying or not. For the economics, obviously it does, but not for the dynamics of the system. So let me talk briefly about how about the beginning of the epidemic. So you can take this equation and divide it by I, then you get the growth rate of infections, and that's given by this. The early times of the epidemic. In the early periods of the epidemic, the number of susceptible people is close to 1, because number of infected people close to 0. So to a first approximation, early in the epidemic, the growth rate of infection is beta minus kappa, because the number of susceptible people is close to 1, and the change in the number of susceptible people, which is given by this term, is close to 0, because the number of infected people is very small. So in the first, say, 10, 15, 20 days of the epidemic, you can think of this as close to 0. You can think of this as close to 0, which means that the growth rate in the early epidemic is just given by how many people a new person infects minus the recovery rate. And therefore, early in the epidemic, basically the number of infected people evolves as an exponential function. The exponential function is this term, which means that whether the growth rate is positive or negative exclusively depends on this R0, this basic reproduction number. If that number is bigger than 1, you get an exponentially growing number of infected people. If it's smaller than 1, then the epidemic never gets off the ground. From the epidemic, how rapidly the epidemic evolves depends exclusively on this number R0, and that's why the focus on this R0 is so important. And I would say, as I said before, the main contribution of economics is to point out that beta might not be policy invariant. It might not be invariant to social interactions, of course, and of course the epidemiologists understand this. And it might also not be invariant to economic activity. And the key aspect of all of this research is time to come to grips to the fact of how strongly does R0 depend on economic activity through this parameter beta. The other thing that you can do in terms of very basic math is you can ask, okay, this is a very short run. The upshot of this equation, forget about details of this, that early in the epidemic, you can expect exponential growth of infections, and the speed of that growth is basically determined by beta kappa, or that basic reproductive number, and that's why people are so obsessed trying to figure out how big that really is. Is it 3, as early research on China suggests, and how quickly does it come down? Has it come down below 1, where it means that the epidemic is subsiding? Also can ask it, what happens on the long run? How many people get never infected, and how many people will get the disease, and how many people will die? At the end of the day, the number of people that never have been infected, S star, solves this. It's mathematically, it's a transcendental equation that has a unique solution somewhere between 0 and 1. And the number of people that had the disease at some point is 1 minus S, because in the long run, there won't be any infected people left. Well, this is the number of people that at some point have had the disease. Let's take the assumption that there's a constant case fatality rate, a certain share of people that have the disease die new. You can actually calculate from that very simple formula the share of people that at some point have had the disease. A fraction new of them die. Best estimates suggest that for old people, that fatality rate is quite substantial, perhaps in the order of 1 to 2%. For people above 65, for young people, that number is fairly small, perhaps 1/10%. So if you give me the total number of people that at some point during the epidemic have been infected, that's R star, then I can tell you the total number of people that will die from this epidemic according to the simple model. And the number of people that at some point during the epidemic will have had the disease is 1 minus the number of people that will never have had the disease. And according to this model, this solves the simple equation. If you really want to have a dirty first approximation, you give me that basic reproductive number. And if that number is not too far away from 1, then as a first approximation, this is the share of people that never had it. So if this number is 2, if each infected person infects 2 additional people, then the share of people that will never have had the disease in the long run is 50%. The number of people that at some point will have had the disease is also 50%. And the number of dead people will be, say, take 0.2%, so 0.2%, multiply that by 50%, and that's your best prediction of how many dead people you're going to have as the epidemic evolves. But that might take quite a while. So the number of deaths that we currently observe is only a very imperfect approximation of that. So the nice thing about the SIR model, this is all analytically tractable, and you can make predictions under the assumption that this R0 is a fairly constant parameter, and that you have a precise estimate of what this R0 is. Bottom line, that R0 is a super important. What does economics have to figure out? How strongly does this R0 respond to economic activity? So this is all broad reading of epidemiology from my perspective, from the perspective of our paper. I'm getting late. This is not quite fine enough. Our paper, we basically say, well, the simple model has only infected people, but it makes a huge difference whether these people are infected, but they have the infection, they have the virus, but they don't have any symptoms. They are asymptomatic. So in our paper, what we basically do, we take the infected and we break them up in 3 states. Those that have the virus, but they don't have any symptoms, which means they might not know about having the virus. And the key aspect of these asymptomatic is these guys still go to work if they're allowed to. They go shopping, and they transmit the virus at the workplace, at the store, and at home because they are asymptomatic. Nobody knows that they have it, maybe not even themselves. Then there's a group of people that have the virus, and they have developed some flu-like symptoms. We call that F. And then there's some people that not only have flu-like symptoms, but they have become severely sick and they have to go to the emergency room. We call them E. So we basically take the SIR model and make it into a safer SIR model, where safer simply stands for susceptible, asymptomatic, flu-like symptoms, emergency room, and then recovered. And among the recovered, as Luke said, one should split up those people that have recovered and those people that have died. So in our more evolved model, the worst case disease progression is that you start not having the virus, you go to work, or you go shopping, or you get contaminated with the virus, you become infected but asymptomatic. You still happily go to work, you don't have any symptoms, you still happily go shopping. Then if you are unlucky, you develop symptoms. You don't go to work anymore. You might have other people go shopping for you. That changes your infection, the spread with which you spread the disease. Then, if you are unlucky, you develop really severe symptoms. So the transition from year to year, mainly old people, young people can happen too, but it's unlikely. And then if you're really unlucky, then you die. But at any point in this chain, there's a good chance that you will recover. And the way we model is that the recovery rates are very strongly age-dependent, because actually the transition between susceptible and infected but asymptomatic don't vary all that much by age, according to our reading. In fact, young people are more prone to getting the disease. But then the transition between having symptoms, having very severe symptoms, and potentially dying, these probabilities are much, much larger. people. So what we do, we basically take this model but enrich it into this safer model that includes these 3 stages of being infected. And again, the key difference is that the guys that are asymptomatic, they have the virus, they can spread the virus, but since they don't have symptoms, they continue to go to work. And it's exactly that these are the people, our own targets, meaning these are the people that are locked down from a policy that says you can't go to work because you might spread the virus. You don't know it, we don't know it, but your economic activity is being reduced because you're infectious, might infect other people. Into this basic epidemiological model, we have an economic very stylized. So let me just give you the very basic bare bones of the model. In order to study redistribution, we have 3 types of people: young and old, work anymore, but they are very susceptible to conditional on getting the virus, dying. Then there's 2 groups of young people. Young people either can work in a basic sector, which we think of as healthcare, food production. That's a sector you cannot shut down. It's central for economic survival. And the young people in the basic sector, they always work and they are not subject to a shutdown. And then there's young workers working in the luxury sector, restaurant, entertainment, and so forth. This is a sector that, in terms of production, looks very similar to the basic sector, but the government can go to that sector and shut down a fraction M of that sector. So only a fraction 1 minus M of that sector is producing. So output in the luxury sector is all the people that can work because they either are not infected, or they're infected but don't have symptoms, or they have recovered. So this is a group of people that are not having flu-like symptoms and are not in the emergency room. So these are the people in the luxury sectors that don't have symptoms, either because they're not infected yet, they are infected but they have not developed symptoms, or they are recovered. So this is the number of bodies that in principle could work. Then the government shuts down as a part of that sector with the share M. So 1 minus M is output in the luxury sector. Output in the basic sector is all the bodies working in that sector that can show up for work. Total output is then given by the sum of the 2. Perfect sum. One key assumption is that people in the basic sector have to work in the basic sector. People in the luxury sector have to work in the luxury sector. There's no substitution. And the key part where the government shutdown comes in, it shuts down part of the luxury sector, which has 2 effects. It reduces output, and it sends a share of these workers that in principle could work. It sends them home. Why would the government potentially do that? Because it exactly is these people, those people that have the disease, don't know about it, are asymptomatic. They are super spreaders of the disease. And since you don't know who these people are, one way to curb the infections from these people is part of the sector. Now, of course, in an ideal world, if you have large testing, what would you do? You would test a bunch of these people without symptoms, try to distinguish between those, and especially between this and those. And once you know that these are people that don't have symptoms, but they already have had their disease, those you send to work, and those guys you keep them at home. But without effective testing, one very, very core substitute is to send 1 minus M of these people home in order to avoid the spread of the virus. The economic model then says, okay, we have sent part of...
Dirk, sorry, one other question on this. So the young are more prone to contagion. That's also a key assumption for some of the policy prescriptions, right?
Yes. So it is the case that the way contagion works, you can either transmit the disease in the workplace, you can work it while consuming, you can do it through social transactions, and then if you happen to be in the hospital, you can transmit it to the nurses. And the assumption is not that the young are exogenously more transmitting, but since the young go to the workplace, and since part of the transmissions happen in the workplace, the young are more at risk of transmitting the disease to other people, just simply because they are more at risk getting it at work, whereas the old people, they are not currently working. And it's not that there's anything that is special about the old It's just that they don't have as much production activity and therefore less prone of infecting other people. Conditional on receiving the infection, of course, the old guys are much more likely to develop severe symptoms and dying from the disease. And that's something that we'll try to calibrate somewhat.
Yeah, so I understand. I'm just asking this question because I don't know about the US, but at least in Europe, there's a lot of talk, discussion around some of these care facilities, these old people's homes, where, so if you have all the old locked up in one place, then maybe this is a kind of a strong assumption. And maybe, I mean, I think your model can speak to it, but you probably come down at a very different policy prescription, right? Because then you have all the forces pull in the same direction.
Yeah. So I think where this is perhaps too coarse is the situation. So there is, I think, it starts with the young people. The young people are more prone to getting this. Then they go to visit their parents, especially if they are asymptomatic. They don't know they have the disease. They visit their parents. They infect old people. And then there's a little bit of a feedback from old people to young people. And I think that transmission from old to the young, if you could insulate the old more effectively, and if you could institute a policy that says the young people cannot visit the old people because you lock them in facilities and you don't allow visitation, of course, that would be a very effective way to curb that transmission back. And when we bring our model to the data, one thing that seems very clear, there must have been something really massively happen in the US around mid-March, where this R0 numbers that initially, according to our judgment, was very high. It must have fallen quite substantially according to our reading of the evidence. And I think this is a very effective way where we realize old people in nursing home, they are very prone to getting this. They are very prone towards dying. You basically want to separate them from the rest of society. And by doing so, it very much slows the transmission of the disease. Absolutely. So just to complete the economic part of the model, so then there's basically two types of policies that the government has. It can control how much of that luxury sector to shut down. But then you have a bunch of workers that in principle could work but can't earn income because they're shut down. So the second part of economic policy is redistribution. There's two groups of people, essentially, those that can continue to work and earn income, and then those people that are shut down from working and earning income, so you have to give them transfers. So CN is the amount of consumption that the people that currently do not work receive. How does that work? These are basically direct transfers through unemployment benefits from the working people to the non-working people. And one assumption is that that act of transfers is costly, meaning if you want to transfer $1 from workers to non-workers because of distortionary taxation, incentive reasons, it's going to cost you $1.38 cents of extra cost to make that transfer because of incentive costs. And so the interplay between these two policies is how much mitigation do you want to do it, how much you want to do it, how much of that sector you want to down. Then you know that the more you shut down, the more people you have to which you have to transfer. Transfers are costly, and that will reduce your appetite towards doing mitigation in the first place, relative to a world where everybody is identical, representative agent, where you don't have this concern about redistribution. So at the end of the day, our economic model is basically an optimal policy design problem that asks, how much do you want to shut down? When do you want to stop? And how much transfers do you want to give to those people that are not working? And there's this feedback loop between between the degree of mitigation and the degree of transfers, because transfers are costly, and therefore that reduces the government's appetite for these transfers. Okay, so I don't want to talk about the details of the model, and in fact, I think given the time, I probably don't have time to talk about the calibration in great detail, but let me just mention there's a bunch of parameters in these models. What do we think is really important? To a first approximation, what is really important is, what's the main benefit of these shutdown policies? Well, you save old people from dying. In these type of models, you have to take a stance on how much is that worth? How much is it worth to keep old? And project to this from an ethical perspective, that economists think about the value of life and put some number on how valuable it is to keep people alive. But if you want to talk about optimal policy, there's no way around quantifying how valuable is it to keep old people alive. Agencies, for example, in the US, that quantify what is called the value of a statistical life. Because if you want to evaluate environmental projects, you want to ask how much is it worth to save an extra life through environmental production. So these government agencies have to come up with numbers. If you take their numbers, the value of life is quite high. Let me translate that a little bit. Maybe if you take the number from the Environmental Protection Agency of the US at face value, it is corresponding to a flow value of about $515,000, or about 11.4 times annual consumption. So that's how much it is worth, protecting one extra year of life. To take a stance on that. So this is one important parameter. The other thing that is super important.
Sorry to interrupt each time. On this, there's actually a question on this kind of related to this value of life. Of course, what you're talking about here is sort of from the perspective of society as a whole. The question is, what would happen if young people would be altruistic versus the old, and value the life of the old? So that's slightly different. How would that?
Numbers, because I will look at sort of social welfare, which is the weighted sum of the welfare of these three groups. Effectively, we have three groups, right? We have old people, we have young people in the basic sector, we have young people in the luxury sector. One thing I will ask, suppose the old guys were dictatorial and they can determine, and this is sort of a world where either the old people have all the say, or the young people internalize utility of the old people by being altruistic. So I can show you, relative to a utilitarian social welfare function, how much more mitigation you would do, and how much longer would mitigation occur. So I will show you exactly those numbers. So to first approximation, if the old guys are dictatorial, I don't think the old guys are dictatorial at all. This is an approximation to a world where you value the old directly, and you value the old through the lifetime utility of the young because they're like their parents. Really important in these type of exercises, and we struggled quite a bit with it, is to come to grips of what I will here call initial conditions. Our thought experiment is, you sit here on April 12th, and now you have to decide how much longer to do shutdown, how large should the shutdown be. You have to get a sense on how does the world look on April 12th, and the key unknown is how many infected people do we have that are asymptomatic, that can transmit the disease, but don't have any symptoms. Now, again, if you had great testing, if you could test the entire population, this would not be an issue. But currently, certainly in the US, we have no idea how big this number is. So what we try to do is we are going to say, and this is broadly summarized on this slide, if you wonder, is we take as hard facts the number of dead people, and maybe even that is severely underestimated. But on March 21, there were 300. On April 12, this exploded to 22,000. And what we are saying is that what do the basic transmission rate, these basic reproductive numbers, have to be to rationalize a world where initially you have very small number of deaths, then this explodes, but it explodes within a matter of 3 weeks. The number of deaths explodes, so you have exponential growth. But at the same time, the number of daily deaths is not all that high. And this leads you basically to a view of the world that says, on March 21, that are already infected, but are asymptomatic. So to the best of our estimate, on March 21, you have about 5.5 million of people that are already infected but don't have symptoms. Much, much larger than the caseload of people that are officially at that age infected and have the symptoms. And when you look at these death rates and you try to come to grips with it, that tells you that initially these infection rates must have been really, really high, leading to a lot of deaths on April 12th. But on the other hand, this must have come down very dramatically. And we interpret this as the outcome of social distancing efforts by governments, voluntarily social distancing by people, and economic shutdowns that exactly started around that time where states basically shut down the economy. So a drastic reduction in this basic reproduction number that makes it such that you have a ton of people that are already infected, leading to deaths 3 weeks later, because it takes a while for people from the infection in a systematic state to the death state. But at the same time, the number of daily deaths is not all that large. And that can only be consistent with the data if the number of new infections starting around this time has been reduced very, very substantially, meaning the number of newly infected per infectious must have come down very dramatically. We think it's under 1. And again, where does that come from? Social distancing as well as partial shutdown of the economy. Okay, then let me just give you a few numbers because I think I should wrap up. So basically, we look at 3 time paths of mitigation policy. Our thought experiment is whatever got us to April 12th, that's what it is. On April 12th, the policymaker has a choice to make of how much is that 50% of the non-essential sector is shut down. That's about 27% of the overall economy. That's certainly consistent with this 20%, 25% unemployment rate that I've shown you at the beginning. So policy 1 is open up at Easter. That's what the president said. At Easter, we open up anything from April 12th on, no further economic mitigation, social distancing. People still do what is privately optimal in terms of social distancing, but no economic lockdown. That's one policy. The baseline policy is not that. Our baseline policy is to keep the current lockdown measure in place up until June 30th. And again, the magnitude is that shuts down about 27% of the economy or 50% of this non-essential sector. And then we will say, okay, what is optimal? Where I will look at optimal by saying weighted sum of lifetime utilities of these 3 groups, the old guys, the young guys in the sector that will never shut down, and the young guys in the sector where you have a 50% problem, or you're a wait and you got shut down and you can't work any further. So let me show you what happens then. So let me first focus on these 2 policy, the baseline and opening up on Easter. This basically shows the number of daily deaths under these 2 scenarios. So this is the baseline scenario, where right now in the US, we're about at, or let me immediately go to the number of deaths. The baseline scenario says around now, we have about 2,000, 2,500 daily deaths in the United States under this baseline scenario where 50% of the non-essential sector is shut down. You keep that shutdown until June 30th, then you lift it, and what you see is the number of daily deaths will increase again before it comes down. So the observation here is that daily deaths are about where they are right now under the baseline policy. You keep the luck, but it's still stubbornly high. You remove the lockdown, you're going to get a rebound of the virus, and it's going to take quite a while for these daily deaths to come down to 0. Certainly by the end of the year, this is not completely done. If you wonder how many people are in emergency hospital and how many emergency spots do you have, this is about consistent with being almost at capacity in terms of the emergency room. What would have happened? Suppose you open up at Easter. This is the counterfactual scenario of opening up at Easter. The number of deaths would be multiplied by 3. The emergency room would be overrun, and part of the number of deaths that we simulate come from the fact that you're going to get a big spike in the demand for emergency hospital. And our assumption is once you are at capacity, the death rate of having more people in the emergency room that you can handle spikes. From a pure health perspective, this is a disaster. You're going to get 6,000 deaths per year. On the other hand, the epidemic unfolds much more quickly, and you go to 0 death much more rapid. This plot basically shows that 2/3 of all the deaths are concentrated among the elderly the ones that are 65 years and older. And again, baseline. And if you would have opened up at Easter, a big problem with opening up at Easter, you're going to kill a bunch more old people because those are the guys that are more severely dying. You can calculate the total number of deceased people under the baseline scenario where you open up on June 30, and the scenario where you open up at Easter. And what I would think is optimal, which I will argue is somewhere in between, but close to the baseline scenario of keeping it up until June 30th. If you wonder what's the gap, it's about 200,000 additional deaths coming from the fact of relative to keeping lockdown until June 30. So the number of cumulative deaths that you avoid if you keep in the lockdown longer relative to opening up at Easter is about 200,000 extra death. And the number of this corresponds to about 0.1% of the population. So under the baseline policy, we're going to have about 0.1% of the population dying eventually from this virus. Opening up at Easter, that goes up to about 0.2%. In the optimal policy, this is about 1.13%. How about optimal policy? Suppose you ask the old how much mitigation you want to have. The result is even the old would say 0.5% might be a bit too high. So current mitigation policy is perhaps too extreme. And why would the old say that? Well, because the old understand that it's going to keep you safe, but it affects consumption. And since consumption has to be financed by transfers from the rest of the economy, part of the economy is shut down, even the old would say current mitigation is probably too severe. But crucially, the old would say, let's keep it for much longer. Let's keep it, say, until the beginning or the end of August before we wind it down, because that will minimize the epidemic and that will minimize the number of deaths. If you ask the luxury workers, those workers whose sector is shut down, way less shut down and want to have it revoked much more rapidly. Why is that the case? Well, they also understand more mitigation leads to less health transitions. It leads to less death among them because they get infected by working. But on the other hand, they are very strongly severely affected economically. Now, they do get transfers from the rest of the economy, but since transfers are costly, their consumption drops very substantially. And this reflects the fact that, true, they're going to get unemployment benefits, but unemployment benefits do not replace nearly the income that they would have earned if the sector has not shut down. So these are the old. These are the young in the luxury sector. If you take a weighted average, what we think is as optimal, that's the blue line. The blue line says, how much should you shut down the economy? According to a utilitarian social welfare function, what we currently do, but you should keep it for longer towards July and August, because that will basically avoid this. I mean, if you get the shutdown and then remove it end of June, you get this rebound of the virus. If you keep it longer, the blue line is optimal. That rebound is being avoided. And if it's not costly to transfer, if there's no dead weight loss, shift optimal mitigation up, then you do more of it. That's to be expected because that just means that it's easier to transfer to the old, it's easier to transfer to the people that get mitigated, and therefore being unemployed by being shut down out from the luxury sector is not such a big deal. The last thing I want to show you, the welfare gains or losses from these policies are very asymmetric. Basically, along the optimal policy, utilitarian, weighted sum of lifetime utility, the old guys very strongly favor that policy. It's 1.1% of lifetime consumption. Young guys, especially those in the luxury sector, they are fairly ambivalent between a policy that it has a partial shutdown or a policy that opens up on Easter. And it's clear why, because these people, on one hand, they do value the fact that they're going to die less likely by being infected, more likely if the economy is opening up at Easter. But on the other hand, their consumption takes a strong lick. The basic effect is they are basically indifferent between opening up at Easter or opening up optimally according to this blue line. guys in the basic sector, for them, it looks a bit better because they are not as severely affected in terms of their consumption. And the old, as I said, they're the main beneficiaries of that policy because it effectively keeps them alive. If you actually just ask the old what is their preferred policy, much more mitigation, you're going to get larger welfare gains for the old. Obviously, it's their preferred policy. And now you use the young guys in the luxury sector, implement the preferred policy by the old, which is extended lockdown for a long period of time. They actually find that less appealing than an immediate revocal of the shutdown at Easter. They suffer from that debate. So if you want to tell a political economy story of the current protest at the state capitals in the United States about opening up the economy, you say, look, you guys, you politicians, you're old, you like those policies to protect the old people. You have implemented a policy that is welfare reducing for us because we get shut down. We rather want to open up the economy immediately. So there's very strong redistributive consequences between the old and the luxury workers in the sun of the young that are mitigated through the economy. These numbers become even larger if redistribution is costless, because then you do more mitigation. So let me just conclude here. The main results seem to suggest that relative to what we currently have in place, you want to have substantive shutdowns, but perhaps at a lower level. So maybe the shutdowns are too severe, but you want to have them for longer, certainly until the end of the summer. The welfare gains from these shutdowns are very unevenly distributed, large for the old, much smaller for the young. And if redistribution is less costly, you want to do more of mitigation. Clearly, the results are sensitive to parameter values, especially the value of life. And Luke already has asked one such question. If you increase the value of life, you want to do more mitigation. If you reduce the value of life, you're going to do less. Obviously, it's very sensitive to how big is R0, how quickly does the disease spread without any mitigation effort, and it's very sensitive to the probability conditional on contracting the virus, how likely you are to die. Now, on one level, and let me conclude with this slide. So, what is this model about? It's a fairly elaborate model of the epidemic. It's some very coarse description of economic policy. So the government is fairly involved here. What is perhaps missing is that here private agents don't do all that much. They don't have that many margins along which to adjust their private behavior. And that is, of course, potentially important. So, for example, if you have strong incentives to adjust your savings behavior, Kaplan, Violante, and Moll have suggested that leads to very asymmetric effect between those guys that have very little assets and those guys that have a lot of them. And let me conclude by saying that here, our assumption was there's people working in one sector, the luxury sector, that sector gets nailed, people get mitigated, and there's not too much they can do about that. And then there's some people working in the basic sectors. The basic sector you cannot shut down. Maybe the basic sector is also one where infections are not all that large. Suppose people can actually adjust their economic activity towards the sectors that are less infectious, then that is very important. And just to end with that, you might remember the paper by Eichenbaum, Rebella, and Trabant, where they're basically a representative agent model with one representative sectors, and they say without any mitigation effort, you're going to get this massive consumption recession, and you get this massive increase in the number of dead people. You might remember that plot from their presentation. Suppose you allow people to adjust across sectors, and sectors are heterogeneous with respect to how infectious they are, because some sectors you have to work, you're a waiter, some sectors, food delivery at home, giving seminars from my office. Suppose there is substitutionability. In a paper with Harald Uhlig and she from University of Singapore, we played that out. And just the substitution possibilities across sectors in a basic Eichenbaum-Rebella economy, once you allow people to substitute and you have some plausible elasticity of substitution across goods, what you're going to get? You're going to get a consumption recession in the benchmark where inflation is fairly high, instead of 10%, you get a consumption recession of 1.5%. And instead of having an epidemic, much more mitigated. And why? Because people, individually rational, adjust and go to sectors in terms of their consumption and work that are less prone towards infections. And if that elasticity of substitution is very large, and if people practice some social distancing, according to our estimates, the epidemic never gets off the ground. So this is a little bit the Swedish solution. If you have strong incentives and strong mitigation forces from private behavior, it might be the case that that is so strong that the epidemic is mitigated in its infancies. So this would be our optimistic view of the Swedish solution, but it does require very strong private incentives. It does require very strong substitution possibilities, and it does require perhaps a government that coordinates on these substitution possibilities. So it's not saying the government should stay out, and Chicago style, nobody should intervene, but it should perhaps mean that the government should coordinate private actions towards sectors that are less infectious.
Many thanks, Dirk, for this very rich presentation. You've been very generous with your time. We basically have run out of time, big time. There were a few more questions, but fortunately we don't have time for those. But I did want to, if I may, impose on you with a last question. Since you are one of the world's leading public finance experts, I know that that was outside of the scope of your talk today, but you sort of ended a little bit on a note. That's why I thought I would ask you, since what's very nice about these heterogeneous models is that you see these transfers between the young and the old, and that is also the political economy very much so. What is sort of, in a few sentences, sort of a big message you would have for us on the public finance front, since we also discuss these issues with fiscal authorities on a daily basis?
Yeah, so I mean, I think from the perspective of the model, so here the transfers between the young and the old have to come out of current output. So I mean, the obvious next step would be to think, okay, let's do that partially with government debt. And of course, you know, governments around the world do exactly that. If you want to evaluate that, I think the next step would be to embed that into a full overlapping generations model where there's future generations, and part of the burden will be pushed on future generations. Now, in our essential world, basically think of the young as not only about the current young, but the young people having children and valuing future generations as well. So this basic trade-off with government debt could be represented between the old and the young. And the clear default line is obviously the old want to have this type of policy in place being financed with public debt, whereas current and future generations say, look, you know, you're going to saddle us with tremendous amounts of public debt, and we might not want to like that. So it's clear that you want to do public debt. And the redistributional consequences are not so much between the young and the luxury and the young in the basic sector, but between the old now and future generations. And that's I've started working on that because I'm very concerned about future generations, partially because part of the lockdown, and that's not here at all, is, you know, I have 3 kids at home. They're not go to school. They don't learn anything. I mean, they have distance learning, but that's sort of more or less useless. What's going to happen to their human capital accumulation? What happens to long-run growth at the same time where we have an explosion of public debt? Now, I think that using public debt with a crisis is very much what you should be doing in terms of smoothing, but the long-run effect on future generation, that is absolutely there. You need an overlapping generation model to model it. It's very much, I mean, certainly on my agenda, and Alex Ludwig, who's here in Frankfurt, and myself, we are starting really very much trying to work on that, because that is absolutely crucial. I mean, my view is that right now the world's burning, grips with the very short run. The long run is all about public debt and human capital accumulation for the young generation, and that's the next generation of the models.
Thank you for that, Dirk. So we will be looking forward to that work from you. We'll keep an eye out for that, and maybe be in touch on that again. So for now, on behalf of the ECB, thank you very much for making some time in your schedule. I know it's early still there. So enjoy the rest of your day.
Yeah.
Stay healthy, please.
Let me just one last remark. So the two papers I talked about, they're on my website. If you have any questions, I will happily answer any emails. So you know where to find me. And I'll happily share the slides as well of those papers with you if you want to disseminate them in any way. So I'm not running from any questions by running out of time. I'm happily answering any of those that your economists, your staff, any of you might have. And thanks for having me and giving me the opportunity to speak to you guys.
Okay. Thanks for your generosity.